Okay, so let's talk a little bit about how Alzheimer's is even diagnosed. And Alzheimer's diagnosis is typically multifaceted and done by a team of professionals. A variety of tests get delivered, scored, and analyzed by the team, and then a diagnosis is made. That's what happened with my mom. It was a neurologist, it was a psychiatrist or a psychologist, it was a couple of other, I think like her primary care physician was involved, and a few others. And my sisters, my dad and I, we went in with my mom to meet with this whole team of people. They ran tests on her. They did labs, and then there were computer tests that she took. Like, there was a whole bunch of tests that were taken. Alzheimer's disease is usually diagnosed based on specific clinical and cognitive symptoms. Memory loss is the signature symptom, obviously. And for women, they may also experience the lack of being able to multitask. I didn't realize that we were coined as, like the the pro multitaskers, which actually multitasking is not really good. I've learned that's not really good, because you can't have focus on one thing at a time, which is really what you should have focus on, is one thing at a time, so that you can complete it, but that you're not like all over the place. But that's a whole different conversation. Difficulty with attention and language is another symptom. Once a diagnosis of Alzheimer's has been made, therapy is usually implemented immediately. Unfortunately, the current standard of care calls for intervention that may manage some symptoms but not seem to be meaningful in terms of impacting the disease process itself. Drugs like Aricept and Namenda might decrease some symptoms, but they do not cure or even slow the disease progression. Some research suggests that these drugs may make the disease worsen more quickly. So, if I could for a second, this was a big conflict for me. So, because my dad pulled my sisters and I into my mom's Alzheimer's journey early on, we were made aware of her medications, her treatment plan, all of this stuff. And one of the things that I noticed was that her treatment plan, or her care plan, or whatever you want to call it, was heavily based on medication. It was written to watch your diet, or maybe try a Mediterranean diet and exercise. But it was a bigger emphasis on taking this medication. And so I started to research the medication that she was taking. I think my mom started with Aricept, and then there was another one. I can't think of the name of it right now. But when I started to research the medication, and then I started to research the studies, the clinical trials that some of these companies had done, and I'm like, none of these drugs have a proven track record of really doing anything. And I'm not even being funny. You can look this up, of doing anything. So, and I'm the type of person where I struggle when I go to the doctor and they give me a prescription. Like, I very rarely finish my prescription out. And I'm not telling you to do that or not. I'm just saying, for me, when it comes to pharmaceuticals, I'm automatically like, what do I need it for? What is it going to do? And so when I looked at all of the data, I'm like, one, it's not going to help it. Two, it could make it worse. And three, it can create these side effects. Like, one of the side effects of the matter of fact, you know what? Here, let me do this real quick. Let us look this up. Okay, so I looked up Aricept, and this is I guess the generic. It's pronounced donepezil. So it's used to treat dementia and people who have Alzheimer's disease that destroys their memory. It's in a class of medication, cholinesterase inhibitors, It may improve the ability to think and remember, or slow the loss of these abilities in people who have Alzheimer's disease. However, it will not cure it or prevent the loss of mental abilities at some time in the future. Like this, it's like, then why am I, like, it's so open-ended, but you're telling me to take it, and they say don't miss your dosage at all. I mean, I get it, but I don't get it. So let's look at what side effects can this cause. May cause side effects. Tell your doctor if any of these symptoms are severe or don't go away. Nausea, vomiting, diarrhea, loss of appetite, weight loss, frequent urination, difficulty controlling urination, muscle cramps, joint pain, swelling, stiffness, pain, excessive tiredness, difficulty falling asleep or staying asleep, headache, dizziness, nervousness, depression, confusion, changes in behavior or mood, hallucinations, abnormal dreams, red, scaling, itchy skin. Some side effects can be serious: fainting, slow heartbeat, chest pain, new or worsening breathing problems, new or worsening stomach pain or heartburn, black or tarry stools, red blood in stools, bloody vomit, vomit that looks like coffee grounds, difficulty urinating or pain when urinating, lower back pain, fever, seizures, discolorations, or bruising of the skin. So there's all of these possible side effects, and some of the side effects are actually some of the possible symptoms that you could see as Alzheimer's gets worse, like depression and changes in behavior or mood. And then on the other hand, some of the other possible side effects are things that could have a negative impact on your body and create more havoc, inflammation, chaos in your body, which would actually exacerbate your brain's condition, i.e. loss of sleep or like bad sleeping. That's very important. Having great sleep is very important. Loss of appetite, giving your body the proper nutrition is a huge thing. So, and I get it that with every drug, there's a bunch of side effects. At the same time, you have to kind of be curious on why the primary treatment plan, the primary thing that you want me to focus on in my treatment plan, at least the doctors my mom has come across, the primary thing you want me to focus on are taking medications that, one, have not been shown to help this disease at all, and two, could potentially make my disease worse because it could actually eat away at my overall health. It just doesn't make any sense, which again is more why I said I have to learn about this disease, because there's got to be a better way. There just has to be a better way. So let's keep on moving. So there was a clinical nurse specialist by the name of Amy Berger in the series, and she said the standard of care for Alzheimer's disease is that there is no standard of care. She continued, the standard of care is pretty much get your affairs in order and good luck. And I can say that was the sentiment that I got. It was basically, you guys, your mom at that time, it was just mild cognitive decline. So it was kind of like, enjoy her now while it's just a little bitty problem, and be prepared for it to get worse. And as it gets worse, we will change her medication around, and you're going to have to start figuring out what you do as she starts to lose the ability to do X, Y, and Z. And that was how I walked away feeling. I don't know about anybody else, but that's how I walked away feeling. The effects of the current Alzheimer's drugs are minimal, and they are not long-term. The best you may get is a bump up, and then you go right back to declining again. When you get to the root cause of the illness, that is when you get a sustained improvement in cognition. So there was a gentleman by the name of Max. Let me not mispronounce his name. Max, I don't want to mispronounce your name. Max Lugavere. Max Lugavere. And I first heard of Max Lugavere. I watch Impact Theory by Tom Bilyeu. It's a great series on, well, it's a great show on YouTube, and he has a podcast. And Max came on to talk about brain health because his mom, she was diagnosed with, I believe it was her form of dementia was Alzheimer's, but she was diagnosed with a form of dementia. And so he too started going down this road of studying the brain and studying health, like studying all this stuff. So he's now one of these experts that is in the series. So this is what he said. He said, we know when we look at research that polypharmacy, and just so that you know, because these are words that I had to look up myself. So polypharmacy means the simultaneous use of multiple drugs to treat a single ailment or condition. My mom takes multiple drugs. We know when we look at research that polypharmacy and the overprescription of these drugs, especially in the elderly and frail, contributes to early mortality. We need to take a step back and ask ourselves whether or not the drugs that we're doling out, almost as if our healthcare system is this grand Pez dispenser for these drugs that really are not that effective. We need to ask ourselves is if this is in the true interest of these patients. It's kind of sad that the language of medicine at this point has been co-opted by pharma. And he goes on to say, he's like, you know I'm not knocking the use of pharmaceutical drugs, period. Like, there are situations where they make sense, but it's gotten ridiculous the level of influence and involvement that big pharma has on the medical industry. It's gotten ridiculous how much decisions that you're being told from your practitioners, your physicians, what have you, are being driven by what's happening with big pharma. So then the next question was, why hasn't there been a pharmaceutical cure? So now Dr. Dale Bredesen is the one who's answering this question. And Dr. Dale Bredesen is the one who wrote the book, The End of Alzheimer's. So he says, we're asking one drug to patch 36 holes, essentially. So imagine, he gives the example of imagining a roof with 36 holes in it, and you have one patch to patch up 36 holes. Well, that one patch might be effective for one hole, but what about the 35 other holes that you have? That's the equivalence of what's happening by using these drugs, which is why they do not work. So he says, in the future, the drugs will be very important in combination with personalized programs. With the understanding that available therapies are limited, we all need to take necessary steps to keep cognitive function intact. So again, this is not the situation where it's like, oh, I broke my leg, I could just go to the hospital, they know what to do, I could walk. Well, you might not walk out, per se, but you know if you go in for your broken bone, they know what to do. You can come on out and your bone will eventually heal. That is not the case for Alzheimer's. And more importantly, they're not even talking to you about prevention or about reversal. You're going to get loaded up with drugs and be sent on your merry way, and it's going to get worse. So what's the best way to not put yourself in this position? Prevention.